Hi and welcome. Now we're in Lifestyle Management. We're on Chapter 13, Part 2. Now in Part 2, we're going to explore what are CAMs. Now I'll tell you right now, I mentioned it in Part 1, Complementary and Alternative Medicines. It's nicknamed or shortened up to be CAMs, and I'll be using the word CAMs or the acronym. Now how effective are they? Are they very effective? And we're going to touch on a number of CAM examples of services and programs. Now, I'm going to jump right in here. I hope this chapter is going to be helpful for you. And remember that with the access to medical information and services online and the variety of different CAMs, regulated or not regulated, that your critical thinking and questioning of claims are important to your health. And I do really emphasize this because not making good decisions and not thinking thoroughly and completely and critically could cause you health problems. Let's get started. Complementary and alternative medicines, CAM. Okay, the medical research community uses terms complementary and alternative medicine or complementary and alternative healthcare to apply to all healthcare approaches, practices, and treatments not widely taught in medical schools and not generally used in hospitals. Now, look at that definition. They apply to all healthcare approaches and practices and treatments not widely taught in medical schools, because these might have other related education certificates or not, and they're generally not found in hospitals. Okay? So they include many healing philosophies and approaches and therapies, such as preventative techniques designed to delay or prevent serious health problems before they start, and a holistic method that focuses on the whole person. Now that sounds very good, and in and of itself it generally is. But we have to still use our critical thinking. Fees for treatment vary from one health practice to another, and from one province or territory to another. Now, Canadians are expected to cover a large part of the cost for CAM services. These are not typically all found under OHIP. They may or may not be under your pension plan or your health plan within the provider or the workplace that you're at. Some of them will be, and some of them will not be. So why people use complementary and alternative therapies? What's the draw, or what's in it for us to do so? Most people who use CAMs say that it fits their values and beliefs about life and health in general. They may have concerns about side effects from conventional medical treatment, or other drug therapies, or they may have had a very disappointing experience with mainstream medicine. So people that use CAM often believe that body, mind, and spirit are involved in health, and most Canadians who try CAMs do so as a complementary health practice. When I say complementary, we're just basically suggesting I will be using hospital services and doctor and nurses services, but in addition to that, I may be using some of these CAMs. Now, there are medical practitioners that support that, and there are others that don't. So let's touch on that. Doctors and CAMs, do they mix? Integrative healthcare is gaining greater acceptance in the medical community. There's more medical schools that are teaching courses in CAM. So that starts to create a universality of what you should expect with certain practitioners in these CAMs. Many doctors are calling upon their colleagues not to dismiss or embrace CAM, but to consider each approach thoroughly and evaluate its potential benefit to patients. So again, the focus is on the patients, and that's where it ought to be. The World Health Organization is creating a web-based classification system for traditional or complementary health medicine to bridge the divide between Western medicine and historical traditional medicine. And we'll see how that plays out in Canada. Fundamental to the integrative care is the necessity of establishing links between the two types of healthcare options and enhancing communication between patients, doctors, complementary healthcare providers and the government agencies that oversee healthcare in Canada. And I would certainly agree that improving that communication will only make it better for overall for patients in the long run. So, are complementary and alternative medicines safe and effective? It's a good question, and I don't think there's going to be a real simple answer. Scientifically studying the safety and effectiveness of CAMs is relatively new. It is beginning because it's become more popular, and so the scientific community wants to make sure that what we're seeing people pursue is in fact, in the long run, good for people. In 2004, in CAM, it's a Canadian research that was being done. It launched the support of CAM research community. Members link with organizations and educational institutes to develop formal CAM research partnerships and initiatives. So rather than excluding people who are involved in CAMs, they're embracing and including and doing the appropriate research to either support CAM research and CAM services or to alter them in some way, make them be a bit more appropriate for public consumption, if you will. In Canada, training standards have been set to govern organizations for specific health practices. However, homeopathic physicians are not regulated in Canada except in Ontario. Massage therapists are regulated in BC, Ontario, and Newfoundland and Labrador, and New Brunswick, but not in the rest of Canada. When we say regulated, it would suggest in some cases that would be a governing body for that group or a certification process. There's no uniform regulation system for alternative medicines in Canada. There's just nothing that covers all. And it probably shouldn't. There's so many different varieties, and we're going to look at them in a minute. If you decide to seek CAM, ask, is it safe? Is it effective? Is the practitioner qualified? What has been experience of other people, and what are the costs? I mean, there's a lot of things we should be exploring before exercising our options of going into a CAM and seeking the services. So, for example, natural health products. It's something that has taken a bigger part of health generally, both in terms of the consumer as well as in terms of patients. In response to growing concerns about the regulatory environment for natural health products, the NHPs, a term used to describe a variety of products such as herbal medicines, homeopathic remedies, nutritional supplements. Health Canada developed a regulatory framework that came into effect on January 1st, 2004. And all of these NHPs sold in Canada now require pre-market assessment and authorization for safety and effectiveness. There's many products that you can buy readily in the States that if you try to buy them in Canada, you can't because they haven't been assessed and authorized for safety. And if they have been in the States, they don't always get that same approval in Canada. So let's look at complementary and alternative medicine programs and services and look at some of the variety. Aboriginal healing is an example of one CAM. Aboriginal healing is a way of integrating health services available through our Canadian health system and using uniquely Aboriginal perspectives that incorporate the four aspects of healthcare, or four aspects of health generally: spiritual, emotional, intellectual, and physical. Now, healing circles, sweat lodges, traditional medicines, and the use of medicine wheels and healing ceremonies are some of the approaches that are being used in the Aboriginal health services. Another one, acupuncture. Some of you may have tried that. It's an ancient Chinese form of medicine. Acupuncture is based on the philosophy that a cycle of energy circulating through the body controls health. Now, you've probably seen the acupuncture needles, very thin needles that are inserted in spots that are specific for these energy circles that increase the flow and stop blockages. Acupressure The therapist uses his or her fingers and thumbs to stimulate certain points to relieve pain and relax muscles. You've probably done this for yourself. If you've been stressed and your shoulders were tight, you've probably put your fingers or your thumb or into your muscles to try to release that. That's essentially acupressure, but certainly the therapist that does acupressure does so with a more precision. Reflexology is based on a theory that massaging certain points of the foot or the hand relieves stress or pain in corresponding parts of the body. Now, there's lots of different variable sources. Ayurveda is a traditional form of medicine, medical treatment in India. Its basic premise is that illness stems from incorrect mental attitudes, diets, and posture. So practitioners use discipline of exercise, meditation, and herbal medications and proper nutrition to support better health. As mentioned in a previous video, biofeedback. Now, biofeedback uses a machine that measures temperature or skin response and relays this information to the subject. The biofeedback can also look at brain waves. People can learn to control usually involuntary functions such as circulation to the hands and the feet, tension in the jaws, and heartbeat rates. So being able to focus and concentrate, you can make these things improved, lower some of these tensions by using a machine that gives you feedback, biofeedback, that lets you know either the tension is being reduced or your heart rate is being reduced or it's increasing. Chiropractic. Again, this is something that maybe some of you are more familiar with because it seems to be more mainstream. Chiropractic is a treatment method based on the theory that many human diseases are caused by misalignment of bones. Research in the last 10 years has demonstrated its efficiency for acute lower back pain. Research is also being conducted on other potential benefits including headaches, arthritis, but findings are inconclusive to date. But it will continue, and we may find more treatment options like chiropractic that will have some good connections for better health. Herbs, botanical medicines, and dietary supplements. Herbs, botanical medicines, and dietary supplements are the most popular form of complementary and alternative medicines in North America. Natural healthcare products are used to treat both internal and external conditions. So something that deals with the internal health or topical that deals with external conditions. They can be taken by mouth or applied to the body. They are sold in many different forms: raw herbs, teas, salves, creams, liquid extracts, tablets, capsules, a variety of different ways. Natural healthcare products are not necessarily safe just because they are from a natural source. So we need to be, again, a thoughtful consumer when engaging in alternative medicines or CAMs. Homeopathy. Now, homeopathy is based on three fundamental principles. In brackets, like cures like, treatment must always be individualized and holistic, and three, less is more. Increasing dilution can increase efficacy. Doses of animal, vegetable, mineral substances are administered as serially diluted solutions. So it's not a lot of that in, say, a drink, but it's enough to make a difference from homeopathic's perspective. Kinesiology is described as the study of human body in motion. Kinesiologists will provide exercise therapy, injury assessment and rehabilitation, ergonomics and workplace design, health and fitness courses and workshops, and gait analysis services using biomedical technology. And they're looking for, are we physically moving correctly with an appropriate range of motion? Massage therapy, perhaps you've experienced and had a massage before from a certified massage therapist. Massage therapy is a general term for the number of techniques that involve manipulation of muscle and connective tissue. It's used to relieve muscle tension and stress, improve flexibility, and enhance the patient's sense of well-being. Now, Neuropathy, not neuropathy, naturopathy. This is looking at naturopathic medicine in its comprehensive, holistic health system that incorporates therapies from traditional Chinese medicines, Ayurveda, homeopathy, and Western herbalism, as well as nutritional approaches, body therapies, and other healing practices. Now, this system also emphasizes natural remedies such as the sun, water, heat, and air as treatment for disease. Naturopathic medicines are regulated in some provinces, and in others they're still working towards regulation. Now, if you've had an injury and you're recovering from an injury, you may have used a physiotherapist. Now, physiotherapists are educated and trained to assess, restore, and maintain physical function. They can assess strength, endurance of muscles, and assess the impact of injuries on physical disability or in physical function. They provide treatment with modalities such as ultrasound, assist in program planning and exercise rehabilitation to restore movements and reduce pain. Now, these are just a small representation of CAMS. And I think if nothing else, what it reminds us about our healthcare system is it is rich, it is full, it has many examples of things that can help us, but it puts a premium on us being aware of what we have a right to know and to be a critical thinker. Don't accept claims carte blanche. Ask questions, do research. If you cannot satisfy answers in spite of how well you want it to be, turn it away. I hope this has been helpful. Good luck and keep up the good work, everybody.